Behind the rising tide of obesity and chronic disease lies a quieter, but deeply entrenched problem: nutritional inequality. Across both developed and developing nations, lower income groups are disproportionately affected by poor dietary quality, not because of lack of knowledge or willpower, but because of systemic barriers that shape what food is available, affordable, and aggressively marketed to them. Ultra-processed foods, UPFs, cheap and convenient yet high in calories and low in nutrients, dominate the diets of many low-income communities, not by choice but by design. Economic constraints are perhaps the most direct driver. Whole, nutrient-dense foods such as fresh vegetables, lean proteins, and whole grains often cost more per calorie than calorie-dense processed alternatives. For individuals and families with limited budgets, this means stretching food dollars to meet hunger, not necessarily health. A $3 fast food burger offers far more immediate satiety than a $3 bunch of kale, and when budgets are tight, calories per dollar becomes the dominant calculation. This economic pressure is further compounded by the time and energy required to prepare healthier meals, resources that are also in short supply for working-class families juggling multiple jobs, long commutes, and childcare responsibilities. Availability also plays a major role. In many low-income urban and rural areas, full-service grocery stores are scarce, replaced by corner stores, dollar stores, or convenience markets where fresh produce is limited and ultra-processed snacks, sugary drinks, and shelf-stable packaged foods line every aisle. These food deserts and food swamps create physical environments where healthy options are hard to find, even for those who want them. Even when supermarkets exist, they may be located far from public transportation or lack culturally appropriate foods, making access a persistent barrier. Layered onto these economic and logistical constraints is the powerful influence of food marketing. Ultra-processed food companies spend billions on targeted advertising, disproportionately aimed at low-income, minority, and youth populations. From cartoon-laden cereal boxes to dollar menu deals and influencer-driven social media campaigns, UPFs are positioned not just as food, but as comfort, status, and identity. In many communities, these brands are deeply embedded in local culture, sponsoring school events, sports teams, and neighborhood activities, further normalizing their presence. The result is a diet high in added sugars, unhealthy fats, sodium, and empty calories, one that contributes to higher rates of obesity, type 2 diabetes, hypertension, and cardiovascular disease in lower-income groups. But the harm isn't just physical. Nutritional inequality deepens social disparities, affecting cognitive development in children, workplace productivity in adults, and long-term healthcare costs across society. Poor diet quality perpetuates cycles of disadvantage, where food insecurity and obesity coexist in the same households, a paradox driven by low-cost, high-calorie foods that fail to nourish. Yet while the problem is complex, the path forward is not hopeless. Policy interventions can make a profound difference. Subsidizing fruits and vegetables, expanding nutrition assistance programs, offering incentives for supermarkets to operate in underserved areas, and setting standards for school and workplace meals all help reduce the cost and increase the availability of healthier foods. Taxes on sugar-sweetened beverages and clear front-of-package labeling have already shown promise in shifting consumer behavior without requiring deep nutrition knowledge. Education still matters, but it must be paired with structural support. Cooking classes, culturally relevant nutrition programs, and community gardens can empower individuals and families to reclaim agency over their diets. When healthy eating is both affordable and accessible, it becomes sustainable. And when public policy treats access to nutritious food as a right rather than a privilege, the gap between economic class and dietary quality begins to close. Ultimately, nutritional inequality isn't just a matter of personal responsibility, it's a reflection of social priorities. A healthy diet should not be a luxury item or a marker of affluence. It should be the default option for all, regardless of income or zip code. Addressing the systemic forces that push ultra-processed foods into vulnerable communities is essential, not only for improving public health, but for ensuring that equity, dignity, and opportunity are served at every table.